Having a mammogram come back abnormal can be a frightening experience. However, I want to talk to you about the steps of what happens next if you have an abnormal mammogram. The next step is usually to go for what's called a diagnostic mammogram. A normal mammogram is a very simple test, and it's looking to see if they see anything unusual about the breast. The good thing about a mammogram is that it's very good for picking up cancer, but it doesn't always do very well getting rid of or excluding things that are not cancerous. So it's very common for women to have fatty changes in their breast or small calcifications that the first mammogram might confuse as something that may appear cancerous. This is why we get a diagnostic mammogram. A diagnostic mammogram is done in greater detail. A radiologist who reads the mammograms will be on site when you have your diagnostic mammogram done, and they're going to take multiple pictures of your breast. Many times they will also add an ultrasound to be able to look at the breast even better and get more images. That will allow the radiologist to focus on the spot that was concerning in your initial mammogram. After a diagnostic mammogram, there's usually 3 outcomes. The first outcome is that everything appears normal and the spot that was suspicious is not of concern, and you can go back to your routine mammogram screening. That's always what we hope for. The second option is that an area may look suspicious but not quite cancerous, and they may recommend close follow-up, such as having a mammogram again in 3 to 6 months to check on that spot and see if anything is changing about it. The last option is the most concerning. Sometimes after they do a diagnostic mammogram, the area still looks very suspicious, and it's recommended we proceed with a biopsy. A breast biopsy is when we take a portion of the breast tissue out, usually with a small needle, in order to look at it under a microscope and do additional stains and testing to see if it is a form of cancer. So if you've received an abnormal mammogram, your next step is to get the diagnostic mammogram. Until you have that diagnostic mammogram, I know it's difficult, but I want you to focus on not trying to worry at that time. Once we order that diagnostic, there's nothing more you can do in the process. You've done everything you can do to make sure you're following up on your health. It can be easy to get stuck in a cycle of worry and confusion about the results, but let's not make any leaps until we have the results back from your diagnostic mammogram.